J'ai un enfant qui était malade. Donc je l'ai envoyé au dispensaire. On a parlé de l'anémie, manque de sang. Donc qu'est-ce qu'il fallait faire? À 5 h du matin, l'enfant a rendu l'âme. Voilà.
Malaria was the cause of death for this father's child, a disease that kills about 650,000 people in Africa, mostly young children. But Inuso Sawadogo took his grief in a positive direction by becoming a volunteer in a research program offering a fresh approach to treating both malaria and pneumonia. Inuso Sawadogo lives in the Banfur region of Burkina Faso in West Africa. Most people here are small-scale farmers growing crops like mangoes and raising livestock. They live in isolated villages without any medical facilities. To reach a health center, residents travel great distances, often by foot. This health center is like thousands across the African continent. It's the only service available to 39,000 people and simply cannot meet all the needs. But today, people living in this region are part of a study using community volunteers to diagnose and treat both malaria and pneumonia, major killers of African children. Volunteers are trained to diagnose the diseases, maintain a supply of drugs, and sell them at a low cost. Studies supported by the WHO-based TDR, the Special Program for Research and Training in Tropical Diseases, have shown that this service reduces the number of deaths due to malaria.
Now we know that in our setting here, you have the two killers are malaria and pneumonia. And we just say why we shouldn't combine this strategy targeting these two main killers.
This new TDR study is being directed by Dr. Sodioman Sarima. He himself comes from the Banfur region, and his own family has experienced the devastation that malaria can cause.
I have several brothers and sisters who had malaria, and I'm quite sure I lost two of my brothers who died after this death was consecutive to convulsions.
This study examines if community health workers can effectively handle more than one disease at a time. There are 3 study arms. In one, community health workers treat children for malaria only. In another, they treat both malaria and pneumonia. And in the control arm, there is standard care where there is no community treatment and they have to walk to the dispensary. 119 villages with a population of 75,000 are participating in this study. This community health worker, Fatoumata Yampa, has been trained to identify the symptoms of malaria. 70% of the adult population is illiterate, so graphic posters and clearly illustrated packaging help explain how the drugs need to be given. Yampa makes sure that parents understand how the medicine must be taken.
Ni sera furanta chukura ibna long furani furanya namando me ni ma takanye bon ibna na foko fura mi suma fura mi bi yanfe kwantara mane ko ayi ko ati kasoro atachukolo wala malo ni yafamu yafamu sisan kono yafamu.
This community health worker, Inusan Sawadogo, has been trained to diagnose both malaria and pneumonia. He confirms cases of pneumonia by using this simple tool, a clock. He counts the breaths of the child per minute to see if the rate is faster than normal. The study is implemented in stages so that all villages in the region eventually receive treatment for both diseases. Villages like this one serve as a control group until they join the program. Dr. Sarima estimates that scaling up the malaria-pneumonia model for a wider population would cost $7 per child per year.
Yeah, so if you have if you just take 1,000, you need $7,000 US, $7,000 US for a year to provide just training to community health workers who are supposed to take care of their kids, to also provide them drugs and pay supervision to this population.
The results of the current study will be known in 2013, when the mortality rates of children under the age of 5 are analyzed. In the meantime, safety monitoring indicates drugs are being properly used.
We haven't seen any difference in terms of misuse of the drug if you compare malaria versus malaria plus pneumonia.
There are other signs that the study is on the right path.
Bon, faut dire que c'est vrai que vous intervenez dans une partie du district, mais nous on a constaté aussi que il y a quand même une réduction globale des cas de paludisme grave dans nos chiffres qu'on a tenté d'expliquer plus ou moins par déjà les interventions et toutes les interventions qui ont lieu chez nous.
En écoutant la communauté, je peux dire que l'impact est positif, en ce sens que les témoignages disent que depuis que l'intervention a été mise en place, ils ont moins de malades et ils ont enregistré aussi moins de décès d'enfants. Voilà, donc l'intervention en valait la peine.
For the people living in these villages, the value of the Community Case Management Program is quite clear.
Tout le monde est d'accord avec l'intervention parce que ça posait des actes concrets, positifs, ça sauvait des vies.
Mais ala ni alu sababura ne fana kɛra banabaatɔw dɛmɛbaga dɔ ye donc ne bɛ ala tando ka alu fo ka waleɲuman dɔn.
Je me dis que si avec Quartem, l'enfant, on pouvait quand même le sauver. Voilà, on pouvait quand même le sauver. Donc, je vais dire que l'enfant, il n'allait même pas mourir.